Hi, Dr. Tracie here from Ambiente Gallerie. You are under corrective care if you are working with us here, or you might be past your corrective care and into a new phase of stabilization or even maintenance. Those are all big words, but I want to talk to you about what that means and also what to expect. Let's say you just started this process and you've had a few adjustments and you're like, okay, what's going to happen over the next year? What did I sign up for? How much is my body going to change? What's that going to look like? So here's what to expect. We see improvement depending on the person, 4 to 8 weeks. And the way it looks is people have less severity of symptoms and then less frequent. It starts to flicker on and off, if you will. And don't be alarmed by that flicker, meaning if you have a few really good days where you didn't have any headaches or no upper back pain, and then suddenly something comes back, that's okay, that's normal. We're changing this really powerfully ingrained habit that your body's been in, or pattern that it's been in. And so flickering is normal, let us know, but don't be alarmed by that. So as weeks and months go by, less severe, less often, then you get to this really fun area in your care where you're not having any pain at all. You'll still feel often stiffness or tightness. So pain's off your plate, still feel tightness. But you're still coming to see your chiropractor even though it's not hurting anymore. Don't be confused by that. That's a little odd sometimes when people are coming in and they feel pretty good. But remember what we're working on is we're working on the underlying cause so this stuff never comes back again. We want to change that pattern that was there. So hang in, make your appointments. This is really the most powerful time in your corrective care because we finally have pain out of the way and we're really working on the underlying issues that were causing that. And then finally, people don't feel pain or symptoms or even tightness. And that's beautiful. You're walking around in your body as if it's invisible to you. And by the way, that is how it's supposed to be. So sidebar, if you know people that you're that rattle the bottle of ibuprofen at work and they're complaining and they're moving around, speak up to them. They may have no idea that chiropractic can solve their problems and that they could be such a better version of themselves on the other side of that process. And finally, towards that end of the year, your chiropractor will notice the tone of the muscles along your spine or your upper back are normalizing. So there's a period of time where my patients don't feel tightness, but I still feel it when they come in. And then towards the end of the year, it's incredible, but so many times people are like, that's just where I hold my stress. But I promise you folks, it can change and you can have normal muscle tone in your body the way it's supposed to. What does that mean? It means, more importantly, that the nerve function is as high as it can be. It's maximized. That's really the goal, is we want you to be at the highest level of your own health, your own self-expression as can possibly be. So that's the process that we're on, maximizing you over the year. It often takes a year or a little more. Is it worth it? Heck yeah. So I'm really glad you're here with us.